Your body is so intuitive if you can learn to listen to it, especially in birth. Hey friends, I'm 38 weeks pregnant, which is so surreal that this pregnancy has flown by this quickly. So I'm bringing y'all my last and final episode in the series, Now That You're Pregnant, What Choices and Options Do You Have? So this is a series I started just to bring some awareness to some of the unknown options and choices that you have during pregnancy that so many women don't know. If you're in this standard OB care like I was in my first pregnancy, I had no idea most of this stuff. I had to research things on my own or just be confronted with it and then have to make that choice pretty quickly. So I just made this series to bring the awareness to you guys so you kind of know these things up front before you are bombarded with all these options and you're having to like make choices on the spot. So today's episode is going to be at the end of pregnancy, going into birth, because that is where I'm at in this pregnancy. We could be having this baby any day now. So stay tuned for the birth vlog. That will be coming very, very soon as I have a baby. But as always, this is not medical advice. I'm never telling you what to do. If some of these options and choices don't feel safe to you, then I would never advise you to do those. You want to birth in an atmosphere with the people in a place where you feel the safest, the most confident, and the most comfortable, because that ultimately is going to make your birth the best possible birth that it can be. So as always, do your own research. I will have links in the description to guide you on that research, just to jumpstart your research. Know these options beforehand and make the most informed decision that is comfortable and honest for you. I try to leave my opinions out of this, but a lot of this that I'm going to share with you today is things that I was confronted with in my first hospital birth. You can see and hear more on that hospital birth in this video that I'll link in the cards as well as down below if you want more information and background on my hospital birth. But this is just some things that I wish I had known up front in the first birth, second birth. Some of these things I'm just now learning in my third birth. So jumping right in, iron supplementation. This is something that a lot of doctors, midwives too, will recommend you doing at the end of pregnancy. And there is a reason for them to do that, because the typical American standard diet is lacking in so many minerals and nutrients. However, if you have taken the approach that I preach all the time on this channel for pregnancy of a whole food-based supplementation in pregnancy, getting your minerals and your supplementation from food sources rather than synthetic vitamins and minerals, then there really should be no need that you need to supplement here at the end. I'm not going to give you like the full background here. I'm going to link an amazing podcast down below that will get you really thinking, are you really deficient in iron? And if you have been doing things your whole pregnancy that are helping your mineral stores, keeping your body from getting that mineral depletion, you should not need to supplement. Again, I'm not giving you medical advice here. I'm just telling you this because a lot of times when we do supplement with that iron at the very end of pregnancy, we go into an iron overloaded state that can be passed to baby, which can cause a lot of issues after birth, such as eczema, feeding issues, milk supply issues for the mama. Just a plethora of things can have an effect from that. So again, listen to the podcast down below. It is one of the best podcast episodes I have listened to yet on this channel, this podcast channel, the Freely Rooted podcast. So check it out if you are wanting to delve more into iron supplementation and some other options you have there. So that's one that is very controversial, but listen to that podcast. I think you'll gain a lot of insight. And as always, you want to have been preparing your body throughout the entire pregnancy and not just all of a sudden here at the end cramming things down just to prepare your body for labor, because the more prepared you are from the beginning of pregnancy to the end, the better, smoother, healthier labor and delivery you're going to have. Next, forced inductions. You are not required to show up to an induction. If you are scheduled an induction 5-6 weeks ahead of time and you're just sitting on it and it's not feeling right and just something doesn't feel right with that, you are not required to show up. They cannot fire you for not showing up to your induction. If you remember, I say this all the time, the doctor, your care provider, works for you. You do not work for them. So if you just don't show up to your induction at 6 a.m. or whatever time they schedule those, nobody's going to do anything. You might get a call and you might get some harsh words, but all you have to do is say, I was not comfortable with this. I'm letting my baby come when my baby is ready. Because many times inductions are scheduled for convenience for the doctor, whether the doctor's heading out of town and they want to be the one to do your delivery, they're going to convince you that you need to go ahead and schedule it so they can be there for you because they are the best provider, which yes, you've had this provider and you're so comfortable with them and you do want them to deliver your baby, but Are you more worried about your provider being there or providing what's best for your baby? And an induction is oftentimes not what is best for our babies. There is synthetic things going into our body. Usually it ends to an epidural, which can cause baby's heart rate to drop, which usually leads to C-sections. Not always, but it can. And if you're wanting to avoid that cascade of interventions, showing up to an induction is not the way to start out an intervention, cascade of intervention-free birth. I was actually pressured and guilted into a forced induction. I didn't really have time to think on it because it was like, you're here, we're inducing you now. I kind of had some words with the doctor. It wasn't my typical doctor. She was actually out of town that day, but again, you can see more on that story, but that is just something that I wish I had been more firm on and not agreeing to that induction, because it really, really, really made for a very long and traumatic labor and delivery. Check that video out if you want to hear more. Number 3, cervical checks. Cervical checks are not required. You can be 2 centimeters dilated for 5 weeks. Just walking around, you can be 4 centimeters dilated walking around and not even be close to going into labor. It is truly dependent on your body, dependent on if you're a first-time mom, second-time mom, third-time mom. Cervical checks are not necessary, even during labor. I mean, if you want them and you just want to know that in your mind, cervical checks can actually bring bacteria. You're putting a foreign object into the birth canal, which can bring bacteria into that area for baby to catch, just infection to arise. And oftentimes, accidentally or not accidentally, the care provider doing the sweep can either accidentally or on purpose break your amniotic fluid, which can speed up labor. They can do a membrane cervical sweep and stretch, which again can increase the speed of labor, which is probably what they're wanting to do, but that may not be best for what you are wanting for your baby, because letting your baby come and descend and twist and turn and rotate in their own timing with those contractions is the best thing for your baby. So trying to speed things up in any kind of intervention, a cervical sweep and breaking the fluids is an intervention. They may not kind of stress that to you that it is, but it is an intervention. And if you can avoid that, avoiding cervical checks is the best way to do so, because those things can accidentally happen when they're doing a cervical check. Whether they mean for them to happen or whether it is a true accident, they're not required though. You don't have to agree or consent to any cervical check. Number 4, Pitocin. So this is one that a lot of times if you are going in for that induction, you're going to immediately be put on Pitocin. Now that is just a way for them to induce contractions, to make contractions pick up, get them in a regular pattern. But Pitocin contractions are a lot more intense than natural God-made contractions. I've had both experiences. I had Pitocin-induced contractions with my first labor, and then I had normal, beautiful, God-given contractions with my second, and there is no comparison. They're rhythmic, they're fake, they don't give your body really time to recover. They're just boom, 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 like super intense. You don't have to agree to that. You can tell them that I'm here, we're just gonna wait this out. My body will go into labor when it does. And that's kind of what I did in my first birth. I requested a very, very, very lowest dose of Pitocin. They were actually very respectful of my wishes. Of course, they wanted to up it to like the highest level and start the labor going and get everything rolling, but it's kind of what I get for agreeing to that induction. But I did have to kind of fight and voice my opinion through that. And they were very, very, very considerate in requesting my honor of keeping the Pitocin at the lowest dose. So you have control of that. Ask them. If they're insistent on putting you on Pitocin, at least ask, what's the reason? Why do I need to do this? Why do I need to put this chemical into my body? If that's something you are concerned about. And if they do, request the lowest dose. Unless it is a true again, if it's a true emergency and they need to get baby out, they're not going to just bump Pitocin up and try to pick up your labor. They're going to take you in and have a C-section if there is a true emergency. So again, you have the option there. You're in control of your birth. Voice your opinion as far as the level and the dosage and if you want Pitocin or not. Number 5, piggybacking off of Pitocin, that goes with an epidural. So an epidural is very common in labor, and if that's something that you're comfortable with and it makes you feel comfortable in birth, go right ahead. But if it's something that you're not comfortable with and you know you're really not wanting one, go in there adamant about it. Don't let them talk you into it. That was one thing I was very adamant about in my first birth. They tried to talk me into it several times, telling me that I needed to rest, I needed to be able to sleep. The Pitocin contractions were just too much. I needed that epidural to allow me to rest. But you don't have to consent. You don't have to give in to that. If that's something you don't want, don't consent to it. Oftentimes epidurals can drop baby's heart rate, which will lead to more unnecessary interventions. When baby's heart rate drops, they're going to want to do this and this and this, which can ultimately lead to a C-section. And no, that is not the dream goal birth for many mamas. That does happen, and it's okay if it happens. You didn't do anything wrong if it does happen. There are true medical emergencies that are needed for C-sections, but when you allow these interventions to creep in slowly, especially if you are not wanting them, just be strong and firm in your choices, and you will be able to maneuver the birth. I'm kind of talking this from more of a hospital standpoint. Many of these things I'm talking about are things you'll be approached with in a hospital, because I'm kind of referring to my first birth and the choices I was presented with in that birth. So epidural is your choice or not. You don't have to agree to it. Might be pretty painful, those Pitocin contractions, but you can do it. Just request them to drop it, tell them to cut it off, let you get some rest. If labor is not progressing quick enough, you may be at the hospital for several days, but we were actually in labor at the hospital for 5 days from start to finish, so it can be done. Number 6, fetal monitoring. So many times they will hook you up to the fetal monitor. That basically just means you're strapped to the bed. You can request that they don't do that. I mean, you could technically not have fetal monitoring. They're going to tell you that it's necessary because they need to keep their eye on baby, because a lot of times they're adding these interventions into your birth, which can fluctuate baby's heart rate, and they want to know those things because they want to be on top of it and avoid lawsuits and stuff. But you can completely deny fetal monitoring. You're probably going to get a lot of pushback for that, but again, you're in charge here. But you can also request the wireless one. That does require some Bluetooth, so weigh your options there. But if you want to be able to move around in birth and they're insistent on the fetal monitor, you can request a wireless one, or you can request that they just use Doppler and they come in and check baby. Now, a lot of hospital staff is not as versed in using a Doppler. Nurses and OBs are. They use them in the clinic all the time. My OB used one all the time with me in the clinic setting, but in the hospital setting, they're usually not using Doppler as much, but you can request that. That's what my midwife does during labor. She uses Doppler to check on baby periodically between contractions, just to make sure everything's okay. So you're not required to be strapped to the bed for fetal monitoring during labor, because many times moving around, moving positions is what helps you get through those contractions and maneuver baby down, pull baby down. The swaying of your hips and twist and just bouncing on a ball is what helps baby move down, and you want to be able to do those things and not just be laying strapped to a hospital bed. So fetal monitoring, look into those options. Ask your OB ahead of time if they can hook you up to a wireless one. What are your options there if you really don't want to be laying down strapped to the bed? Number 7, you do not have to lay down to give labor. In the movies, in all of the shows, women are laying down with their feet in stirrups, pushing baby out. That is not the optimal birth position. The pelvis is much smaller in that position, contrary to other positions such as hands and feet, lying on your side, squatting. There are so many other optimal birth positions, and if you will truly listen to your body will maneuver itself into the position that it needs to get baby out. Your body is so intuitive if you can learn to listen to it, especially in birth. It's just phenomenal that our bodies know what to do. Lying on our backs is typically not the best labor position. Historically, women were not giving birth on their backs. And a little fun fact here that I found is it wasn't until King Louis XIV insisted that his wives, I assume he had multiple wives, lay on their back to give birth, because he had a fixation with watching the baby crown. So a little bit odd there, but that is when lying on your back became more common for women to give birth, because prior to that, women did not give birth in that position. It wasn't optimal, it wasn't comfortable, it didn't help baby get out. So that is more or less for the care provider to be able to have good access, to be able to grab the baby. That is more convenient for them rather than it is for you and your baby. So get in a position that's comfortable for you if you can listen to your body. If you're not on an epidural, if you're on epidural, you're kind of just stuck. But if you're not and you're able to move around, get into a position that your body is telling you. You'll know. You'll be able to sense at what position you're gonna need to be in. With my second birth, I literally was coming into the bedroom ready to push, and my body just climbed onto the bed onto hands and knees. I didn't even have to think about it. It was just natural. And if you listen, your body will tell you. You don't have to fast during labor. So that's actually a really terrible thing to tell mamas. If you're at home, of course, you're going to eat at your own leisure what you want. You may not actually be hungry, or labor may be progressing so quickly you don't think about eating. But if you're having a long labor, a long early phase of labor, you're going to want to eat and stay hydrated. I just shared a video on some of the foods I'm making. I made some labor aid to sustain me through labor. Labor can be a marathon depending on the length of your labor and the intensity of your labor. You're going to want to stay energized and fueled. In a hospital setting, they're going to tell you can't eat, although I got around that in my first birth. I just insisted that I eat because I needed to eat. I was starving, and they were fine with it. But they're really just telling you that because they're preparing you for surgery, because ultimately they know that births can lead to surgery, because a lot of times they don't see natural, normal, instinctful women giving birth. So they are preparing you for a surgery ending birth, and they're not wanting you to eat. So that is not like a requirement. You can eat during labor. You need to eat during labor. You need to stay hydrated and nourished with good, nourishing, mineral-rich foods. I have many videos talking about mineral-rich, nutrient-rich foods. So check some of those out if you want some ideas of things to eat. Okay, getting into after baby is born. You do not have to let them bathe your baby. A lot of times they're gonna put baby on your chest and then cart them off and get them checked, wipe them down, give them a bath. And that's just kind of hospital standard. But there are so many benefits to leaving that creamy coating on your baby. It's like a white, creamy, waxy coating called the vernix. This is actually proven to boost baby's immune system because it kind of protects it from outside things until it starts to get its own immune system from your breast milk and just its own natural immune system over time. It also is very stressful for baby to be pulled away after coming through the birth canal. That can probably be quite traumatic, being pulled away from their mom to go get a bath and hold hands on them, hot water, warm water, rags wiped all over them. That can be very traumatic for baby. It can also lower their body temperature. When baby is first born, they need to be on mama's chest, skin to skin, and let her body help regulate that baby's body temperature. So anytime baby is taken away can potentially lower baby's blood sugar and body temperature, which can cause more interventions for them to have to do with baby. And being on your chest for the longest amount of time possible after birth is what is ultimately the best for your baby. So a bath is really not necessary. We personally don't bathe our kids for a couple of weeks after they're born. That's just our personal opinion. But if you just want to delay the bath a day or at least 4 or 5 hours, that is your choice. Just know you don't have to let them bathe your baby immediately in the hospital. Number 10, a fundal massage. So this is where they're going to come push on your uterus. I don't actually know if I have one of these in my hospital birth. It's kind of all vague once baby was born. My midwife will check my fundus, but she doesn't like massage it. So fundal massages are technically meant to prevent hemorrhaging. However, they can actually cause what they're supposed to prevent. So they're basically trying to massage your uterus back down to its normal size, but our bodies know how to do that themselves. We don't need extra help from outside sources. What actually is going to help our uterus shrink the best and the fastest is breastfeeding our baby the way God meant for it to be. So you don't have to go to a fundal massage. They're going to probably want to check your fundus and make sure there's no clotting or issues there, but they don't have to massage it. You don't have to give your consent to do that. And this last one is very controversial, but all of the pricks and the checks and the shots that they give baby almost immediately after birth, you don't have to give your consent to that. So things such as the vitamin K shot or drops, there's black box labels on that with a warning that you can read more about. It has preservatives in it, polysorbate 80, aluminum. Just do your own research there. It's not required. You don't have to give your consent to that. Also things such as hepatitis B. A lot of times they're going to tell you that this is required for your child to go to school, which in some states it is, but it's not necessary right then and there. It can be delayed to another day, a couple weeks, till the child's 3 or 4 or 5 years old. Again, do your research there, but you don't have to consent to it. Also things such as the hearing test and the heel prick. The hearing test, is it really that necessary that we know our baby can hear immediately after birth or the next day after birth? This can be postponed a couple of weeks or a month. Honestly, when you get baby home, you're going to know pretty quickly if they can hear just by talking to them, their reactions. That's kind of how we saw with our daughter. We couldn't actually get in for a hearing test. We had a home birth and we couldn't actually get in for a hearing test for several weeks at a clinic, and by the time we were scheduled to go, we knew she could hear. We were doing home renovations and my husband would be hammering and we would see her looking around like we knew she could hear. So again, it's not necessary those first couple days of birth. Baby should be with mama, not going off for all these tests. And then the heel prick, same thing. yes, that does screen for some important things, genetic disorders and such, but they're going to send those results off and you're going to have to wait on a lab to read them. So it's not like imminent that the heel prick be done immediately so they can tell you your results right then and there in the hospital setting. So make your own informed consent on those scans and pricks and checks, as far as if you want them done immediately or if you want to delay them a few days or even a few years. That is your choice. That is your child. I feel like a lot of times we are guilted to believe that we don't know what's best for ourselves or our children when ultimately we do as their parents. And we have the say in that, contrary to what we are taught to believe. And lastly, I've said this through this entire series, you are in charge here of your birth. It is your body, your baby. You're bringing your baby into this world, not anyone else. You can fire or ask anyone in the room to leave at any time if they are making you uncomfortable or there's something that they're trying to force you to do. They are not allowed to force you to do anything. You are your own person. You are the mama here. You have the final say so. So take charge on that. Take joy and ownership in knowing that you are the ultimate best thing for your baby. And if something is hindering that, ask that person or that thing or that distraction to leave. You are allowed to fire your birth team at any point during your pregnancy, even if you're in the middle of labor. Again, birthing in a place that feels safe for you, around people that are safe, is going to ultimately bring you the safest, the most joyful birth. And I'm wishing you all the best in your pregnancy and upcoming labor and delivery, but transitioning into the new season of motherhood. If you have any questions about any of this, leave them down below. I'll try my best to answer them. Again, there will be links in the description box for you to jumpstart any research on all of these topics I've just presented. Check out my 77-hour labor story if you want more like hindsight on where all of this came from, where all of this research for me stemmed from. That birth really pushed me into researching a lot more options in birth, knowing that there had to be a better way to birth, and or at least for me personally. You may not agree with me on all these choices and options, and that is perfectly fine. I just want to present the options, present the research, and jumpstart you, challenge you to research some of these things that are just mainstream in our birth culture that have not always been so, and that there could be better options that fit you better. There may not be. You may feel safer in the typical standard maternity setting, and that's perfectly fine. That is going to bring you the best birth. But if you're uncomfortable with some of these things like I was, maybe this video series will help you shed some light on that, give you some places to start your research, and just provide you the most informed, beautiful birth that you could possibly have. Thank you all so much for watching this video, and thank you all so much for being here for this entire series. This has been one of my favorite series to do because I just love talking about birth and bringing awareness to things in birth that you just may not typically hear of. So I thank you all again for watching, and I will see you all in a future video.